What's up, Winter and Sparrow friends? It's your girl Kim, and I figured I was long overdue to do a gastric sleeve surgery post, so I am back to do one. And today I'm going to talk about something that I get asked about a lot, especially from people who recently had gastric sleeve surgery, and that's nausea. Yeah, crappy old nausea, feeling sick, feeling like you want to throw up. It's a common problem not just with gastric sleeve, but with weight loss surgery in general. So let's talk about that. But first, and just a reminder that everything I am talking about today is not to be construed as medical advice. Wouldn't want any of y'all out there to think I'm being doctorish. I'm just recounting my personal experience. So now that we've got that out of the way, let's talk about nausea. So, if you watched my earlier videos, you know that I did suffer from some nausea. And after gastric sleeve surgery, a lot of surgeons do prescribe Zofran. Now, if you've never heard of Zofran before, Zofran is basically an anti-nausea drug that works like a miracle. At least it does for me. But if you were prescribed that, it's probably written use as needed. Um, but let's talk about why you get nausea after gastric sleeve surgery and what things you can do to maybe prevent the nausea from starting. So I'm going to go over some of the common issues. The first thing is a lot of times after gastric sleeve surgery, people will drink their liquids too fast or their protein shake too fast. Now, most of us before gastric sleeve surgery, we probably were used to guzzling whatever liquid down. After gastric sleeve surgery, you cannot do that. When they say sip your liquids, they mean sip your liquids for a reason. Now, the first time I drank water after gastric sleeve surgery, I did have a bit of nausea and I had to slow it down because I was drinking too quickly. Now, so just keep in mind when you're drinking water, be mindful of how quickly you're drinking. Also, I noticed people I've talked to, some people get nauseous if they drink lukewarm or let's say room temperature water, and some people get nauseous if they drink cold water. So maybe you can just experiment with that. I know that I did have an experience maybe the first week after gastric sleeve where I drank water that was too cold, and even though I sipped it, it gave me nausea. So I couldn't drink that ice cold water in the beginning. Of course, I can do that now, but just be mindful of that. Another thing that could cause nausea, like I said, is drinking the protein shakes too fast. Um, Now, believe it or not, after surgery, your body's going to be a bit different. Maybe, let's say, you didn't have an allergy to milk before, maybe you're going to have one after surgery, or you're not. Who knows? But if you're drinking, let's say, a Premier protein shake, which is my personal favorite, and every time you drink it, you feel nauseous and you're not guzzling it down, maybe try a different protein shake. There's out there that you can try EAS or Carnation's Instant Breakfast. I know that for me, Carnation's Instant Breakfast makes me feel nauseous even to this day, more than 2 years after gastric sleeve surgery, whereas Premier protein shakes don't give me any nausea at all. So if you're drinking a shake, let's say you're stuck on a particular brand and you're experiencing nausea, maybe switch it up. Try a different brand. Try whey versus not whey. Just explore a bit. That could definitely be a big issue. Another reason for nausea is maybe eating food that's too soon. Now, just because, let's say, for example, and I also talked about this in an earlier video, when I was given the okay to eat soft meat like chicken, um, I wasn't able to eat chicken. It didn't matter how moist it was or whatever. When I ate chicken, I felt like I wanted to throw up. I felt nauseous, the whole deal. Some people, they're just not ready to eat a certain food yet, and that's okay. And don't beat yourself up. Just, listen to your body. So for me, I tried chicken again. A couple weeks later, it still made me nauseous, so I just gave it a rest. Eventually, I was able to eat chicken, but if, let's say, chicken or beef is giving you nausea, maybe it's too early for your body. Maybe your stomach's just not ready. So that could be another reason. Also, let's talk about your new daily ritual that you have after gastric sleeve surgery, which is, well, at least for me, it's 2 multivitamins twice a day and 2 calcium pills twice a day. In the beginning, I did get some nausea from my vitamins because my body was adjusting, I think, to the size of them. Now, if you're continually experiencing nausea after you take your vitamins, you definitely want to reach out to your doctor. But you just might want to either switch up brands, maybe switch up trying it on an empty stomach versus a full stomach. And this is where keeping a food diary comes in. I did it for the first 2 weeks. Well, actually, probably the first month. Let me correct myself. Anyway, I digress. By keeping this food diary, I was able to see how I needed to space my vitamins out. I couldn't take vitamins right after I'd eaten because my stomach was already full. So taking those big vitamins, and you know how multivitamins are on the large side, they pushed me over that edge where I was too full. So experiment with when you take your vitamins, an empty stomach versus with food. Sometimes with food, it just makes you too full. So give that a try. Also try brands. Switch out brands. Remember, you're not required to buy specially made bariatric vitamins. That's a misnomer. I take, let's see, is it one a day? It's one a day vitamins, and I also take caltrate, or yeah, calcium citrate, caltrate over the counter, which is not made for gastric sleeve patients necessarily, but I take them because they're cheaper and because they do the job. Have you ever noticed how expensive bariatric vitamins are? Why would I pay $60 for the same number of vitamins when I can get a container for $14 at Walmart, and it does exactly the same thing and doesn't cause me any GI distress? So don't feel like you have to do bariatric vitamins now unless you've been instructed otherwise by your doctor. But for me, I'm good with the one a day and the caltrate, no problem. So moving on to the next reason why you might be experiencing some nausea. You ate too much. Now, in the beginning of gastric sleeve, the first 2 months is definitely a lot of trial and error. You have to learn how to stop eating before you get full. If you get too full, you're gonna have nausea. Well, not all of you, but some of you will. I was one of those people. And being full is not like before gastric sleeve surgery where you, let's say it was Thanksgiving Day, you ate too much. oh my God, I'm so full, I can't move, oh, I ate so much, and you just, you ate a lot. You feel a little bit bloated, no big deal. No. No, 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 no. After gastric sleeve surgery, if you ate too much, you just might feel nauseous. You might feel like you're going to vomit. You might vomit. Um, you might have, we call it funny taste in your mouth. Um, it's just not the same. So, what can you do if you've eaten too much and you're feeling nauseous? Well, you can always reach for the Zofran, but what I prefer to do and what I did in the beginning was Altoids are my best friend. To this day, I still use it whenever I feel too full or my stomach's upset. I pop 2 or 3 Altoids. The peppermint helps calm down the lining in your stomach, believe it or not. So that's what I'll do. Also, if I'm too full, I will walk. What does walking do? Well, it helps get the body moving. It stimulates your stomach to start processing that food, moving it to the small intestine. So if you feel sick, walk, walk, walk. That's what I did in the beginning. If all else fails, sometimes you just have to go with the flow and you got to throw up. And it hurts. It hurts in the beginning. I'm not gonna lie. I think I threw up 2 or 3 times in the first 2 months after surgery, and it doesn't feel good, but it taught me a lesson. It taught me when to stop eating. So, if you're too full, that could definitely make you experience nausea. Now, another thing is, and one of the times that I threw up was I ate and then I laid down. Now, right after gastric sleeve surgery, I could not for the life of me lay flat because I had a lot of acid in there. My body was getting used to having this tiny stomach, and a lot of people think their stomach is all the way down here. No, it's you can't see, but it's up here. It's like almost right underneath your heart. That's why they call it heartburn, because it feels like that's what you have. But your stomach's smaller and it's high. And if you lay down flat after you just ate, sometimes those gastric juices will come up and you'll get the taste in your mouth and you'll start to feel nausea. So, until my body adjusted, until my acid reducer, omeprazole, leveled everything out, I would sometimes sleep at an angle, or I would wait 30 minutes before I laid down. And I made the mistake of, laying down too quickly after a meal, and that was one of the 3 times that I ended up throwing up. And let's just say I didn't make it out of the bed either. That was a mess. It came back up. So just give yourself grace. Remember, this is all trial and error. You gotta go through it. Don't beat yourself up. Just roll with it. And if you get nauseous, it's not the end of the world. Just know it'll pass. And if your doctor hasn't prescribed you Zofran, maybe that's something you can reach out and ask for. So those are the main reasons why you get nauseous. But I like to throw in kind of a weird one for me is if it's really hot out, like let's say now here in Richmond, it's in the lower 90s, and I don't know, I'm out, and let's say I'm eating a protein bar and it's hot out. I try not to be outside when it's hot because number one, I have multiple sclerosis and it exacerbates everything in my body. Number two, I don't like the heat. But if I'm out in the heat and I eat a protein bar or something, I notice I will feel nauseous. Now, that just could be weird old me. But if that happens to you, um, don't be alarmed because I've talked to other people who've experienced that also. So hopefully this will help you. Hopefully this will help you. And to give you an update regarding my weight, I have not lost any more weight. I have not gained any more weight. I am basically the same. Let's see, can see I do have excess skin in my abdominal area, but I'm gonna put up a picture that I found of what I look like before surgery and do a side-by-side face. It just shocks me whenever I look at it. But if you have any questions, if you're experiencing any nausea and you're not sure what's causing it, start keeping a food diary. So if you missed my earlier videos, you can always catch up. Hit that subscribe button. Thumbs up would be really appreciated. And drop me a comment. And I hope to see you all next time. Take care. Bye.